A woman, 37 years old, first consultation on February 7, 2006. After bilateral tubal ligation surgery in 1997, she developed persistent distending and heavy pain in the lower abdomen below the navel. The pain worsened before menstruation and became more severe during menstruation. When the distending pain was intense, the muscles and tendons of the hands and feet contracted. The muscles became stiff, with numbness and cold sensation of the skin. Menstruation came 1 week early, with moderate volume, dark color, and ended cleanly in 3 days. She had been treated since November 17, 2005, without effect. At the time of consultation, 1 week before menstruation, the lower abdominal pain and distension below the navel had lasted for 2 days. Vaginal discharge was slightly more than normal, yellow in color, and bowel movement had not occurred for 3 days. The tongue was light red with a thin white coating. The pulse at the wrist was fine like a thread and taut like a string. The doctor considered the main cause to be obstruction of qi movement with accumulation of excess heat and prescribed medication based on the classical formula Sì Nì Sǎn. Prescription: Lupularum root or chai hu, 12 grams, stir-fried white peony root or bai shao, 12 grams, immature bitter orange fruit or ji shi, 10 grams, honey-fried licorice root or ji gan cow, 6 grams, erica peel or da fu pi, 15 grams, corydalus root or yan hu suo, 10 grams, tusindan fruit or chuan lianzi, 10 grams, Sargent toxavine or hong tang, 30 grams, dandelion or pu gong ing, 20 grams, and prepared rhubarb root or ji da huang, 12 grams.
This was 1 day's dosage. The herbs were to be decocted in water and the decoction taken. The doctor did not specify how many times per day. The doctor provided 3 days of medicine. Second consultation, February 10, 2006. Bowel movement occurred once daily, the distension below the navel disappeared, pain was reduced, vaginal discharge decreased. The patient still felt fatigue and had poor appetite. The tongue was light red, with a thin muddy coating. The pulse was fine like a thread. The doctor adjusted the previous prescription by reducing prepared rhubarb root, ji da huang, to 6 grams, and added atractylodes rhizome, songzhu, 10 grams, Cotinopsis root, dongshin, 12 grams. The patient was given 4 days of medicine. Third consultation, February 15, 2006. Occasional mild pain below the navel, mood returned to normal. Tongue and pulse were the same as in the second consultation. The doctor slightly adjusted the second prescription and gave 7 days of medicine. Fourth consultation, February 22, 2006. The pain below the navel had completely disappeared. Note: 1. Sì Nì Sǎn is a classical herbal formula from ancient times. 2. Qi, a term in Zhongyi, referring to a very subtle substance with strong vitality that moves continuously within the human body, including the qi of respiration. Qi drives and activates various physiological activities. When the movement of qi stops, it signifies the end of life. Some substances in the human body certainly exist but cannot be seen, some even exist only when the body is alive, such as the qi of breathing.